Obviously, has been mentioned already several times over the course of the morning or this afternoon. Mobility is one of the big game changers as it relates to how IT is really transforming our ability to deliver care, communicate with between doctors within our organization, and obviously with patients. And the big question mark over this mobile trend is the question of security. And what we're going to have today is two esteemed experts on this topic. And they will be engaging us in a very interactive discussion. They were very clear with me. They really want this to be highly engaging, highly interactive. They've done a lot of great work within their organization, and they're going to share that with us and get you to kind of talk about your challenges and identify some solutions. So with that, I'm going to hand it off to Latoya Crozier, who's the VP of Compliance and Regulatory Affairs at Cognizant HMG, and Corey Wilson, who's the Director of Technology Services and Security Officer at the same organization. Take it away.
Thank you. Good afternoon. Tough crowd. Hopefully everyone had a little churro or a little coffee, kind of liven things up. Today we're going to talk to you a little bit about securing mobile technologies and services. How I wanted to kind of start off is saying that most organizations are already deploying some type of mobile technology. You know, we're all on smartphones or iPhones, iPads, tablets, laptops, the invention of the 24-hour workday, the extinction of the domestic vacation that we all have gotten very used to. But when you look to deploying mobile technologies for the purpose of delivering patient care or for transmitting protected health information or proprietary information, it's kind of a game changer, and it kind of moves everything up to the next level. So when organizations are sitting around the table and beginning discussions on how do we create a mobile platform or how are we going to deploy certain technologies and services, at the top of that discussion, I believe, should be compliance. I only saw one nod, which is more than what I thought I would see, and that's okay. I'm a regulatory attorney, so I'm very biased. But I think compliance should be at the top of the list because the presumption is and should be that before your organization even begins discussions, that you have achieved and are maintaining a certain level of compliance with the privacy and security regulations before you even start to deploy any type of mobile technology. So I'm going to bore you a little bit, with just a little bit of the law, just a little bit, not a lot. If it's too much, just throw a tomato at me and I'll finish. But the regulatory environment has become very, very, very complex. The enforcement efforts have increased significantly. Just to provide some of the context, you know, the three big ones this year, one was Blue Cross Blue Shield of Tennessee. Don't know if you all heard about that. The $1.5 million settlement because they failed to properly implement security safeguards. There were a theft of 57 unencrypted hard drives were stolen from one of their facilities. You had Phoenix Cardiac Surgery, April 2012, which was a small physician practice, but they just didn't have very many HIPAA safeguards in place, had to pay a $100,000 penalty. And then the one that was most compelling to me was in June 2012 when you had the Alaska Department of Health and Social Services, which was the first enforcement action against a state agency. And get this, I mean, this action came because of a self-disclosure, because the government says we should disclose when we have breaches of security, and they disclosed and they ended up getting in trouble because they did not have adequate security safeguards in place and they did not complete or meet a lot of the requirements under the security regulations. So I really think that compliance needs to be at the top of that discussion. So when we talk about compliance, everyone is very familiar with the HIPAA law. It's the national standard that tells us how we are to use and disclose protected health information. When you deal with EPHI, you're dealing with the transmission of just electronic information and the different systems and hardware that we use. Next. Also with the security regulations, they're very, very, very clear that we should have, you know, physical safeguards, administrative safeguards, technical safeguards. There needs to be certain organizational requirements, policies, and procedures. I think the most significant administrative safeguards when dealing with healthcare organizations is the performing of a risk assessment or risk analysis. That is really huge, and something that a lot of companies might think that they have done a good job at, but when you really start reading the hundreds of pages of regulations, which I have a copy in my hotel room if anyone wants to come see, but when you really start reading that information, most companies have not conducted the type of comprehensive risk assessment or risk analysis that they need to. That's going to include really understanding the workflow and inventory of all of your PHI, understanding where all your electronic PHI is going, who's talking to who, you know, when you're talking to your vendors, when you're talking to your clients, even when you're talking to each other if you're a national organization and you have facilities throughout the United States. And what even compounds that is not only do we have the federal requirements, but you also have very state-specific requirements that you have to deal with as well. That also includes, you know, performing some type of gap analysis and just making sure, once again, that you have achieved and maintained a good standard of compliance before deploying any technologies. Physical safeguards, just dealing with facility access and control, you know, workstation and device security. When you look at your technical safeguards, really looking at audit controls, integrity controls, you know, the saying garbage in, garbage out. So if there's no integrity of your data, what you're using for reporting metrics and other things is going to be garbage out. And then just business continuity, you know, in general, making sure you have good disaster recovery plans, making sure that you can go back to a manual process should your IT system blow up, and just understanding your employee access as well. The HITECH Act, you know, came about under healthcare reform. And basically, I used to say the HITECH Act is just HIPAA on steroids. It just expanded the scope of HIPAA, provided some criminal provisions, just, you know, caused certain headaches in terms of the level of breach. You know, there has to be significant reputational, financial risk in order for it to reach a threshold for HITECH. The whole thing of mandatory breach notification, you know, if you do have a security breach in your organization, the mandatory requirement that patients or customers have to be notified within 60 days, that is the federal law. Also a very heightened enforcement scheme, a lot of the fines that are coming along with that, as well as the criminal and personal liability of not just the company but individual members. And then the new rules for accounting of disclosures, which is a whole nother 3-hour seminar by itself, so I won't bore you with that. And so what we wanted to provide for you is just kind of a very high level privacy and security checklist that you can use at your company just to get the ball rolling if you haven't already done things like that. You know, the first one is dealing with, you know, staffing. Do you have appropriate resources allocated to overseeing your privacy and security functions? Those of us in regulatory work and compliance work know that when you're dealing with the operators and the C-suites of any organization, compliance, you know, can sometimes be the stepchild. I mean, you know, you're not a revenue generating arm of the business, and so no one wants to really throw millions and millions of dollars at you. I'd just settle for $1 million actually, but no one really wants to throw millions and millions of dollars behind you. So you want to make sure that you have adequate resources, adequate staff that can oversee that function. Also, do you have real policies and procedures? You know, we all like to type up things that look very pretty on paper, and then no one in the organization knows where to find it, no one understands it, people don't know that they exist. So do you have real policies and procedures? Are you updating those policies and procedures? Are they accessible to the workforce? Are you putting them on your intranet, your internet? Are they on some type of automated environment where anybody can access them if need be? Did I miss one?
No, I think you got that one pretty well. I think, again, Latoya and I both work at the same place. I'm the IT and security arm. Latoya is the compliance arm. So good thing we work together and we actually like each other for the most part. So we're going to, for the most part, I had to say that because I didn't sign up for this event. No, just kidding. Okay. Anyway, but what I wanted to kind of bring to this is kind of an IT spin on things. And again, I want this to be a real interactive kind of part of the presentation. I mean, we're going to get to the next one's going to actually kind of, I'm going to ask you guys questions. We're going to try to be more interactive, like kind of in the first sessions. But you know, kind of tailing on to the policies and procedures, after you update it, it's important to make sure you communicate, as she was saying. But you know, part of me goes, great, you can have all these great policies and procedures, and I have a book like this full of those, but if you're not following them, it's just as bad as if not having them, quite candidly. I mean, when the government comes in or whoever comes in and do an audit on you, and you go back and look, it's just as bad as not having it, quite candidly. So I would really want to kind of add that point. Everyone kind of does the minimum, right? There's regulations out there. Hey, you need to at least do compliance training once a year. I kind of say, well, let's go a little bit deeper in that. I mean, obviously, more is better, but as long as you have the staffing to do it, and do role-based training. Do regular general reminders. I'll kind of call it the data privacy and security wisdom. Once an email, once a quarter, or something like that. And it really needs to be cultural shift within the company itself. I mean, if it's not coming from the top, it's really difficult to kind of, you can't really get a provider to kind of do something unless you kind of get some push from the top, or even just staff for that matter. So it's important that, you get that support from the top. And then, when there's someone that breaks the rule, remediation training. Make sure that they understand the rules and send out reminders as a group, not pointing anyone out, but just kind of make sure the whole company is a general reminder of, hey, we need to make sure we're following the rules, and these are the rules. We can go into a little bit deeper on scenario training, business associate training. I mean, you can get really kind of deep into the training piece, but the goal of this is to kind of give you a few ideas of the different scenarios. If you're not already doing this type of training, these are kind of a few things you can look at and consider. LaToya spoke a little bit about risk assessment, and again, it's just kind of you should do this kind of on a regular basis, just as a gut check. Systems change every year, every month in some cases, in some environments. So for us, it's kind of one of those things as we try to regularly do is kind of a risk assessment gut check is at least once a year. Backups, I mean, this is all everyone pretty much knows, the backups, DR plans, business continuity. Part of the compliance regulations speak to data encryption, data at rest, data in motion, especially on mobile devices. These nowadays there are solutions out there from Microsoft that come directly on your Windows box. You can do BitLocker, you can do PGP, and again, I don't want to get too technical in the weeds. I am an IT guy, so if I get there, pull me out. But there are definitely solutions out there that can ensure. I mean, one of the biggest things that we have done over probably 3 years ago is we went through a whole initiative of just encrypting everything that's mobile, USB drive, laptop, cell phones, iPads, that kind of stuff. And so, being able to manage those and control those is a key. And then, once you start having these mobile devices and all of these, disparaging devices and what have you, when they come back in or they're damaged, how do you dispose of them? That's part of the requirements as well. Last thing you want is to see a laptop hard drive show up there with a bunch of data on it, and someone says, hey, we found this is yours, and there's all this information on it. I mean, that's the last thing you want to see. So make sure you have very good documentation on how to dispose of that kind of stuff properly in accordance with the regulations and your company policy. And make sure, if you're outsourcing that, make sure you get a certificate, making sure that that's been properly disposed of. If you're doing it internal, just make sure your staff sign off and understand everything they're supposed to do in the proper manner. And then breach response is one of the things that number 10 speaks to specifically. And again, that's just setting a minimum expectations with staff, understanding what to do when a breach happens. What data do you collect? Who do you communicate that to? And then how does it escalate from there? So those are those questions. Interactive think tank.
That's Corey about 20 years ago, actually.
I had the ears, I didn't have the hair.
One of the things I wanted to add to that is when people in the organization do the wrong thing, and Corey mentioned remedial training, but sometimes corrective action has to be a little bit tougher than that. I mean, when things are clear violations of the rule, or you have employees that are inappropriately accessing or using information, which becomes a lot easier when you're talking about mobile devices. Sometimes the corrective action has to be termination, unfortunately, and making sure. Another plug I would put in is to make sure that your organization has a very good comprehensive records management and retention policy. I had the pleasure, along with my IT counterparts, to implement a very comprehensive one a few years ago that everyone still throws tomatoes at me about. But
the email monster is what they call it.
But it clearly speaks to, what do we do with our emails? What do we do with when our mobile devices are finished? How long do we have to keep information when we have terminations and changes in staff? What happens to that book of business and that information? And it's a little bit tedious. We have this really great 120-day rule where, you know, things that aren't appropriately filed in the appropriate electronic folder at 120 days, it goes away. Just goes off into space to never be found again. And so it's really about kind of training your workforce and the culture of your workforce to get into, you know, retaining those things and using the information that is actually legally required, which is absolutely necessary to use in the course of business, and not just keeping data around just for the sake of keeping data around because, you know, it's discoverable and other things that can cause you a little bit of pain. So, yes, sir.
I suppose we're talking about misuse of data, your audit trail comes into play here as well. So your audit logs have to be accurate and must have integrity, so you can demonstrate that they haven't been tampered with, especially if you're looking to have disciplinary action and termination of employment. Having a regular business record, a way of bringing that into the courtroom and not being able to demonstrate that it's an actual part of the business record and it has integrity and has not been tampered with. It's not as difficult to demonstrate that electronically as it is perhaps manually. So audit logs play a very important role, not only in helping you to detect the misuse, but also in helping you to substantiate why you're taking the action you take.
Absolutely. And employees will definitely, if you attempt to fire them or terminate them or suspend them, especially in the physician world, are going to call you on that. What documentation, what audit trail, what proof do you have that I did indeed violate this policy? Absolutely. Yeah, that's a whole other seminar. We'd be glad for you to facilitate that one. Right. Right. Awesome.
Well, we've done those types of things too. I mean, we've gone around and done security audits, and again, it's walking in and you go, wow, there's a whiteboard with, you know, all this information. You know, do you actually have, you know, vendors come in here and have lunches in here and that kind of stuff? And so, you know, those are kind of things that just the common stuff sometimes they miss. Go ahead, Latoya.
Who was first?
Yeah, I'll
Oh,
let you
boy.
point.
Okay, we'll go this way. Okay, Mark. Yeah. To your first question in terms of the comparison to other industries, I think, you know, when you deal with public companies that have some of the burdens of, you know, SOX, Sarbanes-Oxley, or other types of legislation, then they too have the same probably amount of scrutiny on them in terms of how they're handling, disclosing, using, transmitting proprietary information, financial data. I mean, I think in the healthcare industry, you know, it's a bit much, and I've heard a lot of providers say that, frankly, it can be a prohibition to their delivery of patient care because they have to stop and they have to think about every little thing that they say and where they say it and how they, address the patient and where that information goes. So I would say, where you have public companies or you have companies that are under other types of regulations, yes. Private companies, maybe not so much if they're not in the healthcare industry. In terms of the burden of, PHI, and are we too wrapped up in it? I mean, that's probably a loaded question for me. I'm a lawyer, for goodness sake. You can never get too wrapped up in the regulations. That keeps me employed. But for other people, I mean, I think the focus, I think the government has done an outstanding job of bringing to light, how serious or what type of consequences can happen if someone gets a hold of that information. PHI in itself, we had the discussion at our round table, who cares what's in the medical chart unless there's some compelling information. But medical records have identifiers that can lead to great opportunities for identity theft. You get someone's social security number, you can create a whole nother identity if you get someone's date of birth or address. So, do I think that it's unequitable or that it's unbalanced? Yes, I think, with most regulations or most, laws, the scare tactic seems to work better than not paying attention at all. But I will tell you that I much rather be on the safe and cautious side of that than challenging whether or not it's sufficient.
I would probably add to that is, years ago, it was the banking, industry that everyone kind of that was the hot topic is, protecting my credit card information, protecting this, protecting that. And, I think that has slowly over time kind of weaned itself off a little bit, where you have all these, different companies like LifeLock and things of that nature to kind of give a sense of comfort. People are kind of now going, okay, where's the next big one? And again, I think healthcare is a real hot topic now in the political realm and in other realms. And so I think there's a big attention on healthcare right now. And again, is it your banking information? Not really. It's your social security number and a few other things. And maybe there's some personal information that could, maybe, be used against you because, a psychiatric thing or something like that. But it's more kind of a damaging to the person, I think, than more so the financial thing. Because again, social security numbers are used in so many facets of the world and just, just common day stuff. I just kind of almost feel it's almost the du jour at this moment, but at the same time, I think it needs to be addressed. It needs to have the same level of security as kind of banking does, and I think that's kind of the next push is everybody's kind of moving that into the banking realm.
Banks tolerate a 4.5% fraud ratio, which costs tens of billions of dollars a year. And the Secretary of Defense has been on the news lately saying how Iranians are bringing down the American banking system. So our banking system may be better than our healthcare system. They may be at it for a while longer than our healthcare system.
Fair enough.
Yeah.
But when you compare our systems to even our counterparts in other countries,
Right.
our industries are lagging way behind our counterparts in other Western countries.
That's a good point. It's all relative, right?
Yes.
Up until maybe 2 weeks ago, it was really hot and heavy in privacy and security, and I believe a statewide strategy, so very hot and heavy in privacy and security. And I was asked to participate in the CMS Region 9 call with the consumer group, and the consumer group was asking the CMS regional director about how to get more of the patient data in the virtual world, that there should be this way that CMS kind of bridges their programs and provides information to patients so that they can create their own space and how patients are very engaged. And I found myself with a conflict because I'm conflicted because, quite frankly, I'm here to protect the provider. And all these rules in my world rules out into initiatives across the state. So how do you man that? My question is, how do you man that communication when I think there's also an opportunity to educate and inform consumers? We're protecting it, but they want to share it. I mean, I'm not saying that they as in everyone, but there's certainly more interest moving forward with more consumer engagement. So how do you manage that?
Yep. I'm sitting here thinking if I have the magic bullet answer to that, I'll be wealthy tomorrow. So I was trying to see what I can say. We talked about that in our roundtable discussion too, and I think that's the challenge for most healthcare organizations that are provider driven. I mean, you have the regulations on one side, but you have this big push where the federal government is indeed telling you that you must share information at some point. And so I don't really You know, in terms of messaging, you have to message it very carefully. You have to make sure that you in no way purport that the regulations or the rules are insignificant or not important, but also have to message the significance or the importance of coming together with your consumers, coming together within your organizations to develop a strategy where we can start doing more information sharing. It's just something that we haven't quite figured out or perfected yet. But someone else might have that magic bullet and would know. Your thoughts? I'm sorry, I can't see.
Anybody else has thoughts?
Well, there were two hands there. What? We're not doing- Oh, okay. I know, you know, in the security regulations, and I believe, you know, the NIST.
The NIST standards. Yeah.
NIST standards are what is required, or what the directive is in terms of just a sheer security regulation standpoint. So for some companies, I don't want to say most companies, but for some companies, generally they're going to start there with what is the absolute minimum that they will need to do or strive to, just in terms of a financial analyst or a impact on their bottom line. And so I think it becomes, you know, an information topic for the executive leadership team or the C-suite in terms of how much money is our company really willing to invest in, you know, regulatory or compliance world as it relates to security. So you know, we definitely start with what we are required to, and then the IT folks kind of let us know if there's something that we need to venture out to, but then it becomes, you know, competing interests all the time between operations and finance and medical management. Yeah.
Right.
Yeah. Yeah. As it relates from what I've seen in the security regs. I think this person was. Yeah.
I could speak to the BYOD. What we've decided to do as an organization is to, you know, you can bring devices, but you have to sign ownership of the device to the company. And I know this seems kind of odd, but by doing so, it limits the business's liability when it comes to the device itself. We now then take management over the device to require the encryption, to require the password, to require, you know, the minimum standards that we would expect in order to adhere to the regulations. So we have kind of, you know, laptops, things of that nature. We haven't really gone to that far yet, because laptops in nature, it's some of the management tools and things that aren't probably as good as, in my opinion, because they're so versatile devices, or an iPad or an iPhone or something like a tablet device that's you know, it kind of does one function. It's got one little app. They've worked a lot better to kind of simplify it, and that simplifying that gives us a little bit better control over the device than what something like a laptop would be. So in a scenario, what we've done is we've said we support in our organization iPhones and iPads, and if you want to bring your own device, you're going to sign over ownership of the device. We'll sign the form. We will then put on our management software onto the device itself. And then that way we can control it. If they want to put cogent information on the device, we need to manage it, we need to own it, we need to control it. Right. We have the ability to remotely wipe. Again, all these devices are mobile, and they're all wired in, and so we can send the wipe command, and that's part of we state that in the actual agreement, saying that we have the right to wipe the device, you know, do whatever we need to do it, GPS locate it, all that kind of stuff. So Correct. That's what we've adopted. And again, the finance folks love it. IT folks, if we blow it up, or we wipe it, and someone lost their old, the picture of their grandmother on the device, I'm sorry, but at least there's that. Not that it's their device and we blew it up. I don't want to get into that. It's kind of our device, and you understand that, and we're going to manage it, and you're agreeing to that. So. Yes. Yep.
I signed it over to you, but my son still wants to play Angry Birds and download other stuff from the internet. Can it still do that? And how are you, if so, how are you combating the possibility of viruses coming down with that are keystrokes and such?
Right. So what we do at Cogent is we actually have the iPhones and the iPads. We only support iPhones, iPads. And the reason for that is they have management tools. We use a product called Mobile Iron. And those, Apple, in order to be able to put an application on an Apple device, it goes through a rigorous testing through Apple. And Apple actually has to sign it, saying that there's no bad anything in it. And so in that regard, we feel that the applications, if you want to put your Angry Birds on there, there is some level of trust with Apple that that there is not any malicious information or code in that. We're trusting that as far as adding the applications to the devices. As far as email and things of that nature, again, it's all backed into our system. So, and we have security put in place through Mobile Iron to be able to kind of to keep that where it needs to be. And again, Apple has also enabled sandboxing of all their applications. So if you install an application, you actually have to allow it to talk to another application within the iOS device. So that kind of interoperability with some approvals and things of that nature, we can kind of lock that down. So we as a company decided that it's your device, you put your iTunes account in, you get what applications you want from Apple, and we're going to manage it to make sure that it's encrypted, to make sure there's the password protection, make sure there's a screen lock, and then we advertise our applications, our emails, and things of that nature. So, a good example that you had talked to earlier, Frank, was about the SMS, the communication in SMS, and that's a struggle we find a lot of our clients are under. With us being in 130-something hospitals across the nation, each hospital is kind of doing something a little different to try to solve that problem. And, we're kind of trying to figure out how we adapt to that as well and work with all the different hospitals to be able to support that. So I'd love to have a conversation with you later about that piece because that is a struggle we're running into as well. Well, and that's where things I think are a little different with Cogent. Is we're a hospitalist company, and our applications currently are web-based, and so they don't necessarily need our devices to be able to do their job. Now, if the hospital wants to provide them a device, generally the hospital is going to manage the device. So that's kind of where there's a separation for us, and probably in some of the other environments around here is that, the only thing that we provide currently, Cogent does, is email and things of that nature, and calendaring and things of that nature. But as far as real mobile applications, we're getting to that spot right now, probably here in the next year, that we're going to have our own applications. But again, it's going to be one of those scenarios again, going, okay, here's a tablet doc. Now you're going to go to this hospital, and the hospital's going to go, well, we're going to want to manage it, and we're going to go, well, we're going to want to manage it. So those things are definitely going to be coming about, and I know there is some technology out there that's coming out that you'll be able to have different profiles on your device to be able to log in, kind of, here's my Cogent profile, and log in, and here's my hospital profile, and be able to both kind of manage the device. And so I think that's probably where things are going to start going. At least that's what I've seen from a few different vendors out there that do that.
And I do believe, or maybe not, but I think our providers do have the option to just get a Cogent-issued smartphone. If they don't want to sign over their personal phone,
Right.
then they can request a Cogent-issued smartphone, and they can just use that one for work if they would like.
We've had a couple scenarios where the hospital says, we want you to provide it and you manage it. So that's kind of how we've kind of gone about it, is okay, either we provide the iPad or iPhone, or the hospital says we'll reimburse, or we haven't really kind of touched on that bring your own device if it's kind of for a hospital purpose. If it's within Cogent parameters and what its purpose is, then we kind of do this bring your own device, and that's kind of the road we've taken to this point. Exactly.
Yeah. Yeah.
And that is one of the things that we are in discussions about right now. If we're going to enable our workforce, we're going to provide iPads out to every provider that we have. How do we manage that? You either have to beef up your IT infrastructure. Not that I'm going to try to plug, but AT&T has a service now where they said, okay, tell us where you want to send them, what you want on them, and we'll deploy them for you. And when they have problems, just call us. We'll do the repairs, we'll do the exchanges, we'll do all that kind of stuff. And even if it's not AT&T device, it's a Verizon or whatever, it doesn't matter. They'll handle and manage all that. So there are outsourcing options now for that kind of a thing.
Just maybe to add to that a little bit, I think I would have called this discussion security deploying mobile technologies and services in the real world. And the reason I would say that is this is not a technology problem because the technology to secure mobile devices exists. It's existed for a long time. It's not a regulatory problem because there is no law out there that says don't secure your devices. So you're free to secure them as much as you absolutely want to. What it really boils down to is how do you do these things and operationalize them in the real world, understanding the impact on your business operationally. So, and even some of the discussions that we've had here were around operations. We weren't about technology or even regulation. So I think what it ends up being is sort of a blend between actually a trade-off between usability, user buy-in, and the cost-benefit analysis for the user. So if you're going to take something away from me as a user, you have to be giving me something back in return. And so I think it centers around how good are these apps and how much are they going to make the lives of the user easier. So as an example, if you've got a doctor who says, I'm opting out. I don't want you guys to control my device. If your alternative would be, okay, look, use the desktop version. Stop your work in the middle of the day, find a desktop, fight with the nursing staff for some time to work on it. Or BYOD will let you put it on our network. It'll cut down on your time, make you more efficient, allow you to hit your numbers, whatever that your internal metric is. But in order to do that, we have to make sure that your device is secured and complies with our policy. IPC has recently deployed our own mobile application. So we actually coded and developed an iPhone app and used an MDM solution to deploy it to our providers. And immediately we got some of that feedback. And we have a discussion forum, so people were like, so if I buy a new house, do I have to give you the controller to my garage door?
Yeah.
All kinds of stuff like that. But at the end of the day, after, in fact, we use a tool called Yammer that allows us to communicate. So someone had Yammered that, and I had sent an entire Yammer as to why we're doing this, what the reasons for it is, what the gain, and all that. It was, pretty lengthy Yammer. But at the end of which, the guy said, "Okay, you win. You can have my." I'm signed up. So I think with some explanation there and showing people why you're doing it, a combination of showing them why you're doing it and what the benefits that they stand to gain from it, they're going to want to opt in. Because at the end of the day, guys, we can't, cat's out of the bag. People
Yeah.
want technology. They want to
Yeah.
be able to have it. And for an organization to say, well, we're just not quite sure about the legalities of it, or we have to evaluate technologies, that just doesn't fly anymore with your users. Eventually, they're going to say, am I working for a company that's techno-enabled, or do I need to go work somewhere else that gives me more flexibility? So I think as folks in IT healthcare, we have to quickly assess what it is that we're trying to achieve, and then go ahead and give that to our users, because very quickly we're going to find ourselves behind.
And I think to
Oh yeah, absolutely. They're going to find it. Yeah, the alternatives work.
Yeah, exactly.
I think to kind of segue into that, thank you for presenting our next few slides, Roy. We appreciate that. When you talk about beginning the discussions or choosing as an organization what you're going to do, it's really important on the front end. And a lot, some companies don't take the time to do that, to decide what the true operational impact is really going to be. Is your IT infrastructure going to be able to adequately support, deploying mobile devices to 1,500, 2,000, 4,000 physicians, depending on how big your systems are? Another consideration to consider is your different service lines. Are you, entering into service lines such as psych or skilled nursing facilities or other types of areas where the regulations are even more stringent on how you can deal and transmit protected health information? The rules are a little different. And then strategic objectives are very important. I mean, sitting around the table and actually talking, which doesn't cost the company anything to do, but you'd be really amazed how many companies don't really sit around and just talk. You don't have your operators talking to your providers or your providers talking to your legal team to really, sit around and see what is going to work strategically as a company. Where do we want to be, and how happy are our providers and our physicians are going to be? It might be a question that a lot of people in the room don't want to ask, but it's definitely one that you need to ask, because happy physicians make the world go round. And so you want to make sure that your providers are happy that they're going to be able to use the mobile technology that you put in place. And then once again, the impact to, your bottom line. If what we're bringing in today, the technology or the applications that we're using, are we going to be, bored with that? Or is it going to be obsolete, 12, 18 months from now? And are we going to have to spend the millions and millions of dollars again? Another piece of that in terms of due diligence is, from a regulatory perspective, a lot of people don't think that these discussions warrant board approval or board level governance, but it very much does. Because of the enforcement and the implications of the privacy and security regulations, your board of directors should, number one, be on notice that you are indeed deploying a mobile technology, and you should have their support and approval as to how much money you're spending, how many resources are being allocated to it, because human error and human behavior are a huge part of any type of security platform. That means there's going to be a moderate to high risk involved, no matter what types of safeguards you try to put in place. And so board approval is definitely key. And then just some market analysis. What future trends regarding innovation are you seeing? What are your competitors doing? What's working, what's not? How are changing regulations or changing trends in just your particular industry going to impact the way that you are now trying to deploy this current technology?
Yeah, I would add on the value piece, as it says up there, will they use it for its purpose? I mean, that's kind of the thing. Are they going to take it home and play Angry Birds or give it to their kid? Those are kind of things that unfortunately happen. And so you have to make, if you're going to take a venture into this, you have to make sure you have the applications and have the push to kind of get them to use it. And make sure you have everything that is you can get access on a computer. Try to make it in a kind of a single pane on an iPad. Get that interoperability piece to provide that value. And
Do
then
you want to move to challenges? What time is it?
we're good.
We're good.
I think we're still good.
Okay.
So again, we can talk high level talk through this if you want. I mean.
One of the things that they were asking is just kind of asking, just general questions, and it's good for us to hear too what our colleagues are doing in the field, just what kind of steps, are you all taking to really assess your security level or your standard of compliance while you're establishing or in some cases implementing your mobility platform?
Yeah, I mean, the risk obviously when you get a mobile device, it's leaving your walls. At that point, anything could happen. So there's an elevated risk with that. And can your company handle the appetite? You have the appetite for that, because there's definitely a cost. There's a higher level of cost and support, as we spoke to earlier.
With privacy, once again, one of the things that I have found throughout the years in practice is that mobility does not change or alter human behavior. So if you have employees or you have physicians who are not good stewards on how they used or transmitted PHI, if they were not good stewards on how they documented in terms of medical record charting or coding or things like that, then mobility is not going to be the magic bullet that makes all of those problems and issues go away. It's just going to compound it and actually, expound your risk. And so I think, when it comes to privacy and really training your workforce and training your providers, what they do without the mobility is usually going to dictate what they do with the mobile technology, and you really need to pay close attention to that as well.
Yeah, way back when Cogent, years ago, actually had a mobile device. This was probably 8 years ago. And we used one of the HP Palm Pilot type devices, and we had our app, and we did our charge capture. And the technology really wasn't there yet because you were finding the battery life was horrible, trying to get the data from the device. There was no broadband. There wasn't a lot of Wi-Fi in the hospitals. And so, we were a little ahead of our time, almost too much, because it was very, very painful because we handed out devices to every single doctor. The repair, the battery life, I need to rebuild my laptop, or the OS isn't working right. All these things were a real high overhead. And were we getting the value of it? Not really. And so we kind of pulled that back eventually and went into more of a web-based platform. And now here we are again, 5 years later, kind of looking to move back into that realm again. And to do mobile devices, because again, now the technology's there, the battery life's there, the applications are now becoming there from a hospital standpoint, healthcare standpoint. Let's see here, which goes into interoperability. Again, how do you get all these disparate healthcare systems and put it onto something that's useful and valuable to the provider, to where they can, get access to that. And again, sometimes these systems come with some sort of mobile app, sometimes they don't. If they don't, and again, that's the question I kind of present to everyone out here is, how do you do that? Do you build it yourself? Is there companies out there now that are actually looking at, okay, I have Cerner for this, I have this for that, and how do I pull all that together to make it a useful tool for my doctor? A lot of the things that we've done in the past is we built it ourselves. We've kind of found that there wasn't really anybody there in those spaces to kind of do some of that stuff, so we built it ourselves. But there are more players out there. There are more, more technology companies that see this as a way of doing things. In fact, we just did a review the other day of a dashboarding company to kind of provide a dashboard from our data warehouse to the providers so they can see where they are. Right on an iPad, and it's got the full graphs and pie charts and all that kind of stuff. And so even if the app isn't there, can you get the data there? Is kind of where I was going with that. Is can you pull the data from that system and present it in a manner that is useful to the doctor? And then connectivity, which again has the connectivity is the other point. Is you got to make sure that there's connectivity, and whether it be broadband, whether it be wireless. Obviously, you need that in order to really make this work. Yes, sir. I agree with you. The technical space, even the management, if you just go back to the mobile device management, even 2 years ago, there was only a few players in the space, and now there are so many players in that space. You don't even know which one to hardly choose. You kind of look for the best of breeds. You go to the Gartners and things of that nature. So I completely agree with you.
Another thing that we kind of talked about at our roundtable discussion, depending on what industry or services you're providing, interoperability can be not so easy depending on whether or not you are a company that owns the hospitals in which you are functioning in, or if you are an organization that partners with hospitals. And if you are an organization like us that partners with hospitals across the United States, then you just run into challenges because every hospital client is different. Their needs are different. Their technologies are different. You have, hospitals that, have the resources to have the latest and the greatest, and then you have those very, small bed hospitals who are just struggling to get by every day. And so when you go in and you start, asking for interfaces in terms of sharing data and sharing information, a lot of times you don't always get the reception that you would like. So when you start talking about putting mobility devices in, I mean, that's a huge consideration. What are your hospital clients doing? What are the hospital's strategic plans moving forward that might impact your book of business in terms of how much deployment you get to do? From a workflow concern, I mean, it's very important to just take note of the kind of internal communications that you're having for several reasons. Once again, we're partners in crime, which is a good thing from my standpoint as a regulatory attorney, to have a techie person that can actually help me understand that when I'm writing these policies and I'm implementing this change, what exactly I'm doing, what's the impact going to be to the operators, because a lot of times it's easy to work in a silo and for operations to decide, okay, we want to do this, we want to deploy this, we want to make sure that we can, get the information, find the data for our quality improvement initiatives, and then they're not talking to IT who's saying, who's going to support that? Wait a minute, we don't have the staff to do that. And then you have the CFO going, who's going to pay for that? Nobody put that in the budget. And so you just have all these different variables going on. But just from an application perspective, just understanding how communication flows within your organization, internally, externally to your vendors. What type of information are you transmitting to who? What kind of information are you receiving? How is that going to integrate or transfer into a mobility platform? When we deal with confidential and patient information, that's huge. And there's going to be human error and there's going to be mistakes that are made, but what I can tell you in no uncertain terms is that the federal government is becoming very, very less lenient on honest mistakes or things that just happen during the routine course of business. The standards are high, the bar has been raised, and so it's very important that you document exactly how you are communicating patient information. How are you transmitting that? Is there a policy that touches everything internally, everything externally? And it's hard to do. I mean, I sit here and I say this, but in terms of practical time, I mean, we go and perform security audits and we do fun surprise visits. It's always fun to surprise facilities when you go and they walk in and see the regulatory attorney and the IT guy come in and they're just like, oh, what did I do? But, you perform because I have no idea sitting in my office at corporate what my counterparts in operations or the fields or what my providers are facing and dealing with. I hear providers saying, I don't understand why we can't text, diagnosis and patient information. I'm just like, la, 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 stop talking. But they're like, it's a prohibition to how efficient we can be. If we have to stop and we have to check our email so you really have to know what's going on out in the field and understand the challenges that your providers and your operators are faced so that you can establish policies and put platforms in place that are going to make sense. And then once again, physician behavior. I mean, physician behavior is very significant in the deployment of any type of mobile technology. And you can sit as a compliance person or as an IT person and you can point your finger and you can preach and you can tell them this is what you got to do or you're going to get in trouble or, you're not going to be able to work your shifts. But at the end of the day, they're the front line for your organization on who the patients see. It's important that they are happy. It's important that they can work efficiently, that their productivity is going to increase based on the mobile technology that you have deployed. And so workflow concerns don't always get the type of attention that it needs to get because it's kind of people just make certain presumptions and assume that those things are in place, but they're generally not. So it's important to take the time to do that.
Go to the last one here, and this is kind of more of a wrap-up. I mean, a lot of these things we've already spoke to. About deployment. The only other add I think we'd add is when you outsource the contracts piece.
Yeah, making sure that, you as an operator or you as a lawyer are reading the contracts, and lawyers take great pride that we can read and understand any contract. Well, I'm here to tell you that I am an attorney, been practicing for some time, think I'm bright, but when I see contracts involving information technology language, I am the first person to run over to the IT department and say, help, I don't understand what that clause means. And so it's important for operators and lawyers and your chief medical officers and your executives not to take for granted that IT needs to be a part in those negotiations. IT needs to be a part in the negotiating of those contracts. They need to be able to tell you whether or not you can actually deliver what the contract you're signing is saying that you're going to deliver, because it's very easy for us to sign our name and then worry about it later.
Just one last piece I'll kind of end on here as far as this list goes that we haven't touched on is, one of the things that we're kind of struggling is we're going to deploy these devices. How do you, as far as the cost goes, do you just give them the device? Do you give them the device with the case? Do you give them the device with the warranty in the case? Do you give them a device, all these different things, or do you just kind of wing it and pay for the repair when those come in? And so, again, those are kind of things that we're kind of working through right now, and I'm just curious if anyone else is kind of figuring that, or, especially if you're doctors walking around with an iPad and, seeing all these patients that have, pneumonia or something like that, the germs, cleaning them, things of that nature. I mean, that was kind of one of the things years ago we were looking at going, do we get a device that you can put in the autoclave, right? And some of those devices are pretty intense a few years ago with that technology. And again, it's kind of one of those things that now that we're kind of back into this again, where they're using these devices at bedside, how do we address those kind of issues? So just, again, items for thought.
And reporting capabilities, it's very important. Any type of device or technology that you deploy is going to be user-friendly for your operators. We talked a lot about quality metrics, understanding dashboards, seeing the information. It's important that when you deploy certain mobile technologies and services that somehow you'll be able to retrieve that data and generate it and communicate it in a way that makes sense to your operators. Because if that's not happening, then you're probably not going to get buy-in from management to spend the millions of dollars when they're not going to be able to use it to track the things and the trends they need to use from an analysis standpoint. And then innovation. I guess there's always the latest and the greatest. There's always going to be some new technology that's better than the last. And so what is your cutoff point? You don't want to invest millions of dollars into something and 12 months later go back to your board or go back to your CEO and say, hey, I need another $4 million because this is going to be better and this is why.
Any other questions before we wrap up? Perfect.
Thank you.
Thank you.
All right, we have another 10-minute break here. You can go and refresh your coffees and your drinks. We'll be back here for our final closing session of the day, which is our afternoon keynote from Mr. John Teeter, who's the former acting CIO of HHS, talking about a vision for the future of healthcare. Thank you.